Hello everyone and welcome to our presentation on apprenticeships for allied health professions, both support worker staff and registered staff. My name is Mary Harvey, and when I'm not seconded to the faculty as a workforce development lead, I'm an advanced practitioner occupational therapist working in adult social care in Wiltshire Council.
And I'm Sue Elliott. So I'm working with Mary as one of the workforce development leads, but when I'm not seconded, I'm the head orthoptist at Salisbury District Hospital. So what we wanted to do today was tell you about one of the two projects that Mary and I have been working on together. And our project aim was to look at the current use of apprenticeships within our region. As Mary said, this is both for registered staff and for non-registered staff. So we're looking at all the levels. We're looking throughout all the professions that we employ in BSW and at all levels. So it was really a scoping exercise to see what everyone's doing. Is there a difference between organisations? And we went as wide as possible. So we contacted a lot of the voluntary sector. We did have some input from some private hospitals in our region, as well as the big organisations. So probably lots of you here contributed to that. So thank you.
In this talk today, we're going to be talking about the advantages of apprenticeships and what they can bring to your team. We're also going to talk about our scoping project that we've completed, and then we're going to share with you our recommendations of what we found that you might be able to take home and use in your work. So here we have the current availability of AHP apprenticeships at level 6, that's degree level apprenticeships that are available. And we've listed our most local providers. Across the BSW region, we actually are using 5 out of 6 of these. So we're doing really well. And I want to share with you some of the upcoming AHP apprenticeships to look out for in the next year. So we've got art therapy at undisclosed location, but we've got dietetics and speech and language therapy coming on board both in September 22, we believe. So that's very exciting. So why use apprenticeships? I'm going to look at this from an organisational level first. You're already paying into a levy fund if you're a larger organisation, so you might as well use that money that you're paying in order to retain some of the really motivated staff that you've got who want development opportunities and give them the opportunity to progress. Have you got a really difficult to fill vacancy at the moment? Because it could be an opportunity to recruit into it via an apprenticeship. Time to think sideways, think laterally, what can we do here? From the perspective of the individual completing the apprenticeship, the advantages are huge. People can, they don't have to move away from home to go and do the training. They can commute 1 day a week usually, and they can stay in their main job and continue to earn while they learn. They might not really fancy going and doing full-time study, and this may really appeal to them. So it's got massive potential for staff well-being, staff satisfaction, and motivating your workforce. Over to you, Sue.
So currently within BSW, you can see the pink line there. Level 6, for those of you who aren't familiar, is undergraduate level. So this is staff who are undertaking a degree, usually 4 years, via an apprenticeship route to become a registered AHP. And they're by far the most popular in the areas that Mary showed earlier. The paler blue line actually shows that we do have a substantial amount of people in our area studying at levels 3 and 5. So for those of you who aren't familiar, that's GCSE level and A level. So it may well be, when we're talking about AHPs, assistant practitioners, senior healthcare support workers, and then a smaller amount at level 7, which is master's level study. Now I just said to Mary, oh, it's getting towards 11s and we've put lots of pictures of cakes on there. So apologies in advance, we might get some stomachs rumbling. But we just thought it was a nice analogy showing the 4 different levels of this scoping project, because what we wanted to do was make it as an inclusive. We've already talked about the different organisations and the different professions, but within that, we wanted to understand what are the issues for people on the ground, for people who are leading the apprenticeships, and the AHP leads. So we did 4 lots of data gathering from all these different levels. So from the AHP support workers, we had 193 responses. We sent out a questionnaire via a smart survey link, asking them their experiences of apprenticeships, the advantages from their point of view, but also the things that they found difficult. What are the challenges? What are the barriers to them? So we got lots of responses, which was great. We then sent out a questionnaire to the AHP apprentices. Mary and I just finally got apprenticeships after about 6 months, so bear with me. She says I've got it. So 36 respondents from people currently undertaking apprenticeships, so I jinx myself now. We also went to either the AHP leads, this may be team leads, it may be heads of service, depending on how the structure is in each organisation, and got quite good responses from them because the barriers they face, the challenges they face are probably different than the other staff levels. And then we actually went to visit all bar one of the apprenticeship leads and kind of a little semi-structured interview just to get a little bit richer data, but again, understanding from their point of view. So we had 8 respondents. So in total, we had 276 data sets, which we thought was great. Scott would be in his element, all that data to analyse, Scott. Yeah. But we just felt we got a real good representation from all levels, all organisations, and of all the different professions, which was great. So one of the things, Mary's talked about the advantages, and we can probably all think of those, but actually what are the issues that people are facing? What are the real barriers at all those different levels for people actually utilising apprenticeships for AHPs? You can read them all for yourself though. I'll just pull out a couple of the top ones there because they were the biggies. Work-life balance, that came up at nearly every level, that people found, yes, I can do this. Actually, you're undertaking a degree, you're working, you've often got family life, home life, so it's actually quite difficult. One of the questions when we did the semi-structured interview, Mary and I said to the apprenticeship leads, do you prepare people to understand the level of study that they're taking? And everyone actually did. But when we spoke to the apprentices, they said, actually, this is really difficult. I kind of understood it, but I didn't understand the gravity of it, and that this is a real big undertaking. So that's still a barrier for people, or something that they're finding difficult when it comes to apprentices. Communication, Mary will elaborate on a little bit further, some parts of that, but that can be within the organisation, between the HEIs, the higher education institutes, and either the organisation or the individual themselves. So again, something that people just need to be aware of and think. We asked people, a little bit controversial, we said, what's your relationship like with the HP leads when our semi-structured interview? And actually, some people, I said, actually it is quite poor. So there's a little bit of work to be done there. Backfill came up time and time again, all the different levels. I'm kind of preaching to the converted, I know, but it's very difficult to support someone, an AHP on an apprenticeship, if you're not going to get that backfill. As head of service, I'm still expected to see the same amount of patients, keep the service going, and release someone to do an apprenticeship, minimum of 20% off-the-job training. Some of our colleagues, nurses, other people may have safer staff levels, so it may be easier to get backfill, but that was certainly a biggie that came up. And you can read the rest for yourself.
So when we looked at the data and drilled into it, we found out that across all these 4 levels on the outside, 3 common themes were coming up in relation to the Higher Education Institute, or the HEI as I'll call it from now on, and they were in relation to communication, entry criteria and process, and these really were challenges for people. So Sue and I saw this as an opportunity to get in touch with the Higher Education Institutes and discuss it. So we looked again and we saw that actually 2/3 across BSW of our AHP apprentices are doing their apprenticeships at the University of West of England, or UWE. So it made sense for us to contact them. So they're the people we went to next, and we had a really good meeting with them. And at this point, we shared our issues that had come up across all 4 layers relating to communication, entry criteria and process. And they were really receptive and listened and said, actually, this is nothing new. We expected some of this. We are trying tirelessly to disseminate information, but it's not very easy, and they were keen for us to help. So if we can link you up with some of that information later on, catch us in the break and we'll get you in touch with them. But they have board meetings that managers are invited to. They have Microsoft Teams channels that AHP managers can use to help them, and they also offer one-to-one webinars to help people get apprentices up and running. So if you're struggling because of communication, there are opportunities out there. They also said we're really early on in the stages of lots of these courses. Some have only been running a year. And so it's to be expected that it's not all sorted, so we need to give them time. At this point, we realised that we actually had 5 layers to our cake, not 4, because the HEI was like the icing connecting each layer together, trying to communicate with everybody. So we've actually done a broader scoping exercise than we realised.
and got a bigger cake than we realised, which is always good. So just coming on to putting together some of the recommendations. The pink box, we've divided it into 3 different areas. A lot of the stuff in the information in the pink box, the information we've already talked about, the process, the communication. It's worth just mentioning awareness that when you say apprenticeships, people often aren't aware. As Mary said, a lot of the courses are new. There's quite a traditional view sometimes of apprenticeships, so people don't understand that actually via the apprenticeship route you can become a registered AHP, or you can study at master's level. So it's new and word will spread, but it's just kind of letting people know those opportunities are available. We talked about preparation and support. I wanted to just speak about the middle one, because as you can see, the appetite is there. People are undertaking this. It's a really good opportunity. But are we using it to our advantage when it comes to things like workforce planning? So we've heard Scott say, oh, actually, there may be a difficult, we've got these 3 different professions that we've rated as red in our RAG rating. So what are we doing about that? Can we think longer term? Can we think about growing our own? Can we think, actually, these people have worked in this department. They know what the job entails. They are already settled in the area. They want to do this job. So yes, it's not a quick fix. Apprentices take a little bit of time, and we've already talked about some of the issues around them. But could we think about that as a recruitment and also a retention issue for our staff, and grow our own? Thinking about that workforce pipeline going forward, as you say, you're thinking about the here and now, but we need to think about long term. How are we going to continue to keep, grow, and ensure our staff work to the very top of their potential? Unresolved issues, backfill still stands on there, and I think that's going to be around for a little while. I don't have an answer, but if people need to be aware of that before undertaking it, maybe have the conversations with other people in their organisation and see how they can support an apprenticeship. In a bigger department, there may be 2 or 3 people really wanting to undertake an apprenticeship, and that can have a massive impact on your service as the AHP lead if people are going off 1 day a week, or sometimes more, depending on the courses you do. The courses, as Mary said earlier, they are expanding. So there's new ones coming online. So there's new locations, because geographically it was a bit tricky for some people to get to them. So that will be something that's coming in the future, and hopefully make them even more accessible. And just thinking about those relationships, we've already had those conversations with some of the HEIs and within your organisation.
So we told you about some of the barriers that we found. We just wanted to share how we are trying to break down some of those barriers. We discovered that information was a key issue, and we've gone on to produce a video which will be out very soon. Watch this space. Specifically targeted at apprentices in AHP world, so that they can look at it and they can have some of their myths busted, and they can be given some of this key information we're sharing today.
So we just wanted to leave you with a few quotes, and these are just, we asked people, do you have any other thoughts? And I think this bottom one here, this innovative way to develop our workforce, is something that we will see more and more, and I think apprentices are a great way to develop our workforce and access training.
So we've stuck with the cake theme throughout, but our take-home message is you can have your cake and eat it. You can earn on the job and continue to study and get a qualification, whatever level you want to be within, whether you're an AHP support worker or whether you're already registered. So we just encourage you to see this as a huge opportunity for your team and for the individuals you support. Thank you very much. I don't know if we've got time for questions.